Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter P. Today I'm going to talk about a platelet disorder. First of all, let me just bring up the emergency situation. Are there any critical conditions warrant emergent visit? Spontaneous bleeding. That's really, it's urgent because when the platelets, usually it's not happen, but when the platelet is really low for those who is undergoing chemotherapy or have other autoimmune diseases or using any medications cause the severely decrease the platelet. In terms of the number, the clinical laboratory test has the number, but for the patient, if you have this spontaneous bleeding, not just the probably nose bleeding or petechiae, your body turned like a lot of bruise. If that's the case, you probably need to visit your emergency department as soon as possible. Particularly for those, like I said, has chronic diseases, undergoing chemotherapy or other taking other medications, might have this immune-caused destruction of platelets. So if that's the case, you really need to see the emergency. Can you manage at home? I actually know you. By saying manage at home is you can take over the kind of medications or doing anything. But this is the case even though without doing anything, but it has to be diagnosed, it has to be monitored periodically. For example, the platelet, there's a normal range, and lower that normal range, it has to be keep watching by the physicians, professionals, and to make sure that number do not cross the threshold, the deadline, the threshold or the line of the serious bleeding. So that's probably you cannot manage at home, even though without doing anything sometimes, but it has to be observed, follow up closely by the physicians. So that's the clear concept of this decreased platelet. So first of all, let me just talk about what are the platelets. Platelets, I mentioned before when I talk about the coagulation, mentioned briefly. Platelets are the fragments of the megakaryotes. That's huge cells periodically shedding those fragments in the blood. They're very tiny fragments, and had a lot of chemical components. And the platelet, if the platelet is too much, then will cause thrombosis. That's also is another emergency. If the platelet is too much, cause the coagulation, over-coagulated the blood. That's also has a risk, particularly for those who have chronic disease. So that's one of the common medication, aspirin. You probably heard it all the time. The mechanism for aspirin to take for those who had the risk of coronary artery disease, for example, and hyperlipidemia beyond 50 or 55 years old, your physician recommends you to take this aspirin. The mechanism for this aspirin is to inhibit the thromboxane A2, which inhibit the cyclooxygenase and decrease this thromboxane A2 and decrease the coagulation activity. So this is the fundamental mechanism for the platelet function. So the platelet really in terms of the function, can limit the inflammation, going to the injury site to seal, to promote the coagulation. So that's the fundamental of this platelets. And the number of the usually 100 to 300K, that's the normal range, or 150 to 300K, probably that's more accurate for now. If it's too much, then of course it causes this hypercoagulated stage. That's why, even though it's not too much, but still taking the aspirin, that's the benefit to taking the aspirin for those at the risk of hypercoagulation, thrombosis, or had hypertension, hyperlipidemia, diabetes, taking the aspirin to prevent activation of platelets, to stop to prevent thrombosis actually. And for this, what happened if the platelets not enough? Usually it's not symptomatic. It's usually you do not know unless the number really low. For example, lower than 100K, for example, or the decrease of platelet in a sudden acute phase, immune caused or medication caused, for example, suddenly the platelets dropped dramatically. That's the case. The patient will present as a purpura. So it's the body start to become like a bluish, a lot of the bleeding actually. So talking about the bleeding, if the platelet is not enough, different from the deficiency of coagulatory factors. So the platelet causes the bleeding, usually superficial, from the nose, under the skin. Not on the other hand, if the coagulatory factors are not enough, then will cause deep bleeding. So the bleeding caused by the platelet deficiency or malfunction, usually you see under the skin or epistaxic, the nose bleeding. So this kind of symptoms or presentations. What are the causes? One of the most common causes from young to across the age group actually, especially young people, is called idiopathic, which means unknown reason, but very likely are caused by the autoimmune reaction, which means after the recent upper respiratory tract infection, for example, body generates antibody. The purpose for this antibody is to fight the virus. At the same time, recognize platelets as the target. So then attack the platelet. So decrease the platelet, cause this purpura, idiopathic. So and there are other causes like a DIC, which is diffuse intravascular coagulation, usually caused by the severe disease, end stage of cancer or infection, severe infectious disease. If that's the case, this platelet was consumpted actually, because the body need to overcome this infection and somehow cause many microthrombi, use up the platelets. That is another cause. And medications. A lot of medications can cause this decreased platelet, or the genetic diseases cause the inborn platelet dysfunction with lack of enzymes or lack of numbers, or cannot function normal, a variety of them. But anyway, so this is in terms of the clinical significance for this decreased platelet. So usually really does not affect that much unless the number is very low, unless those who had pre-existing end-stage diseases or undergoing surgeries. If that's the case, your physician will definitely address this and correct it before the surgery, and also to replace it with packed platelets. So anyway, this is about the platelet disorder. Taking home message is really for those who had pre-existing conditions, like I mentioned before. Talk to your physician about, first of all, taking aspirin. That's the purpose for this video, why aspirin is good for you. And also, for those who had pre-existing end-stage diseases, undergoing procedure, or undergoing the chemotherapy, I'm sure your physician follow up with you and discuss with you, and will periodically test your blood platelets and other blood cells. So I'm going to stop here and hope it helps, and thank you for watching. I will see you next time.